I'm Dr. William Morgan, and I work at Chambers Medical Group. I'm here today to talk to you about how we treat injuries that may develop in a motor vehicle accident. The knee is a very commonly injured joint, particularly in slip and fall injuries as well as motor vehicle accidents. The knee will frequently hit the steering wheel or hit the dashboard and sustain an injury. The examination of the knee is usually performed in a supine position like this patient is. And what we're looking for, number one, is we're looking to see if there's swelling of the knee. And this is frequently felt at the very top of the kneecap itself, where there's a pouch, and that fills with fluid, and we can see if there's so-called fluid on the knee or actually bleeding in the knee itself. The examination is done to be sure the patient has full range of motions. So this would be full extension, and this would be full flexion for the patient, which is good range of motion. It means there's no fractures with anything blocking the joint. We would then do a ligamentous examination, and the first part is the kneecap, where it tracks in the knee itself, and we can see that from extension to flexions here. And as long as that is tracking properly, then we assume that the kneecap does not have a fracture in it. So these structures are looked at by stressing them. And what we do is, with the medial collateral ligament on this side, is we try to open up the knee joint. The anterior cruciate ligament is a very important structure in the knee because it's very unstable if the anterior cruciate ligament is not functional. And this ligament keeps the articulation between the femur and the tibia, so there's no forward translation. So we try to mimic that motion by pulling on it. And this is called an anterior drawer sign. And again, we do the same type of motion here by pulling forward on the tibia, and that's called a Lachman maneuver. And this patient has a very solid ACL. Despite the examination, if the patient continues to have significant pain, then we may image the knee with an MRI so we can better see the ligamentous structures and be sure that they are intact.